This case concerns a delay in diagnosis of throat cancer, said to have occurred because our client's treating general practitioners didn't recognise the red flags and didn't refer him to an ENT. Our client was a 55-year-old retired police officer. He attended his GP clinic between August of 2022 and January of 2023 with symptoms which included right-sided ear pain, UTI, ear infection, wax, and tonsillitis. Ultimately, a tonsillar tumour was found in February of 2023, and that resulted in chemotherapy and radiotherapy over a 5-week period. Now, to succeed in his case against the general practitioner clinic, our client needed to prove that there was a breach of duty of care by the GPs. The question was, did the GPs fall below the standard of care reasonably expected of a GP? And did that breach cause his injury, the throat cancer? If successful, he would be entitled to common law damages for his pain and suffering, out-of-pocket expenses, as well as expenses into the future, and loss of income, including superannuation. Now, in this case, our client was always going to win the breach of duty. Our client had demonstrated clear symptoms, persistent symptoms, notably right-sided ear pain or talgia, and that should have triggered the general practitioner to do a thorough examination and further scans. And if a proper throat scan had been done or a proper examination had been done, a mass may have been seen earlier, prompting an earlier referral to an ENT specialist. There was a supportive GP evidence, a liability evidence that said that the standard of care was compromised. Ultimately, the big issue here was causation and whether or not the delay caused our client's throat cancer. The question here was whether an earlier referral meant a smaller tumour or different staging or less intensive treatment would have been required. And critically, would it have avoided or reduced the chemo or radiotherapy and therefore reduced the risk of the side effects now complained of by our client? Ultimately, we obtained liability evidence to support the fact that the delay in the diagnosis and the delay in the referral to the ENT specialist did cause some injury to our client. Now, the defendant's case was that even if the referral was late, the cancer biology and stage may have meant that the same treatment was required anyway, so the outcome may not have changed. So to win this case, we had to turn to expert evidence that ultimately concluded that on the balance of probabilities, diagnosis X months earlier would have meant treatment A rather than treatment B or less of treatment B, and that would probably have avoided or materially reduced the complications caused. And we were therefore successfully able to obtain an award of damages in the sum of $550,000 plus costs for our very deserving client. So if you believe you've suffered injury as a result of medical negligence, you can find us on our website, maxiomlaw.com.au, or call us on 1800 85 30 85.